All right, so we're going to take a look at the leg. Like I said, what we'll do is start with the upper leg hip muscles. So, just to kind of get you oriented with what you're seeing on the overhead here, here's our entire leg model. So our foot's down here, knee, and then here we've got the top of that iliac crest, that hip bone. So what I'm going to do is just kind of zoom in on upper leg hip area. So let me zoom a little bit. So again, you can see the knee right here, and then this is that hip bone, the iliac crest that we're seeing there. So I'm going to start by looking at the anterior side of the leg, and we'll kind of identify everything we can here on the front, starting on the inside of that iliac crest. What are we going to call this muscle lining the inside of the ilium? Iliacus. Yeah, the name matches the bone that it's located on. So again, iliacus, lining the inside of the ilium. Here's our iliac crest, and that muscle is lining the inside of that ilium, iliacus. This muscle right here is a pretty major muscle that does connect leg to the torso, and it does make connections to like your vertebrae and whatnot, and can sometimes be a source of pain when like runners often will aggravate this muscle, and it can cause low back or leg or abdominal pain. This guy right here is called the psoas major. Psoas major. Good. Psoas major. Okay, so psoas major, iliacus. Next, I'm going to go to the outside of my hip. There's a little muscle here, and if I just tilt the leg a little bit, you can see the fascia. We learned about fascia today. You can see the massive amount of fascia here that runs down and goes all the way down to our lower leg or tibia bone. So connecting the ilium to the tibia, this is often called the IT band, iliotibial band. It runs from the ilium to the tibia. There's this little muscle that connects into it. This guy is called the tensor fascia latae. Kind of sounds like a little coffee drink, tensor fascia latae. So fascia, because look at the fascia that it connects into, right? Latae, because it's on the lateral side of the leg. It's a hip muscle. It's connecting into this big piece of fascia on the lateral side. So tensor fascia latae. Okay. All right, next, what we're going to do is look at our quadricep muscle, our quadricep. When you hear quadricep, how many muscles do you think are part of that group? 4. 3 are visible right now. The 4th one is deep, meaning we're going to have to remove muscles to get to it. All right, so let's start with this one in the middle. What's this guy called? Rectus femoris. Good, so femoris, again, is telling you location. It's in the femoral region, which is the upper leg. Rectus tells you the direction of the myofibers, the cells. So we can kind of see how the muscle has like a striped kind of appearance. And that's because of the direction that the muscle cells are running. So rectus really just has to do with the direction of those fibers. Rectus femoris. What about this one right here? Vastus, because now the fibers are going a different direction. The name has changed from rectus to vastus. vastus, bless you, lateralis, because we're on the lateral side, like our IT band here. We're on the lateral side of the leg. So that would make this the vastus medialis. Again, the fiber direction has to do with that word vastus, and medialis because it's on the medial side of the leg. So that's 3 of the 4 muscles that are part of my quad. Rectus femoris, vastus lateralis, vastus medialis. There's one other vastus muscle, but it's underneath our rectus femoris. So to see it, I've got to take my tensor fascia latae off. Okay. Another muscle that I'm going to remove we haven't quite learned yet. This is called the sartorius. I'm going to move that out of the way. And then I can remove my rectus femoris, get down to a deeper layer here, and this is my vastus intermedius. Vastus intermedius. Okay, so we got the 4 larger muscles making up that quad grouping. Vastus intermedius being the deep one, rectus femoris being on top of it. So when I put it back together, I'm putting on my rectus femoris. Vastus lateralis being on the lateral side of the leg, and vastus medialis being on the medial side of the leg. So that's my quad. So let's go through again. This is my iliacus. This is my psoas major. This is my rectus femoris. Underneath it would be the vastus intermedius. This one here is my vastus medialis, and this one is my vastus lateralis. Good. Okay. So next what I'm going to do is kind of work my way through the inner thigh muscles. Inner thigh muscles. So what I have to do is sort of rotate a little bit so I can see the medial side of the leg. I am going to start with this muscle that actually kind of crosses over. Bless you. Crosses all the way over from the outside to the medial side. And I had just mentioned the name of this guy. This guy is called the sartorius. 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 All right, so sartorius. I'm going to follow it all the way down. And what I'm going to do is just go backwards 1. And I'm heading up a big muscle called the gracilis. Gracilis. Now, gracilis is going to kind of be a landmark for me so that I can tell the difference between my 2 adductor muscles. So you guys have adductor magnus and adductor longus. Adductor magnus is going to be just behind the gracilis, okay? And it looks pretty big. It actually runs underneath gracilis, and we could see some of it poking through right in there. But the main muscle we see in front of gracilis is the other adductor muscle. This is my adductor longus, okay? So gracilis is going to be kind of my division between my adductor magnus and my adductor longus. Then I'm going to follow my adductor longus up. Here's my pubic bone. And there's a little muscle just to the inside of the pubic bone here. At least it looks little from this view, right? And this one is my pectineus. So think pectineus up by the pubic bone. Pectineus up by the pubic bone. So let's go through what we've got so far on there. This one is my Iliacus. Good. This one is psoas major. Good. What's this little guy here? Yeah, the coffee drink. The tensor fascia latae. Good. Okay, this is my rectus femoris. Underneath it would be the vastus intermedius. Good. This is my vastus lateralis. This is my vastus medialis. Good. The one that crosses over to the inside is sartorius. Good. This muscle here is the gracilis. If I go behind gracilis, I'm on my adductor magnus. If I go in front of gracilis, I'm on my adductor longus. And if I go up to my pubic bone and move over, I'm on my pectineus. Pectineus. Good. Pectineus. All right, good. Question? Did you have a question? Or you're just stretching? No? Oh, okay. Okay. All right, so one more grouping that we have to do, the hamstring. So the hamstring's on the back of the leg. There are 3 muscles for the hamstring. We can keep rotating. We were here on adductor magnus, right? If I rotate my leg around, now I'm all the way to the back. I can even see my IT band here. That was my adductor magnus. Now I've got 1, 2, 3 muscles here. 1, 2, 3. I'm going to zoom in quite a bit just so you guys can see something. And I'm going to turn down my light just a little bit to cut some of the glare. Whoop, too much. All right, well, it's not going to get perfect. But, all right, so 1, 2, 3. Do you guys see this line right here? Okay. See the number 17 and the number 16? These 2 muscles are kind of stacked. The one on top is called the semitendinosus. So the way that I remember it, tendinosus is on top. Membranosus is underneath. Okay? Semitendinosus, semimembranosus. Good. Okay? One other thing I want to point out. So I'm going to kind of trace my semitendinosus. So the border of it is like this. Okay, you see the border there? So this is actually part of my membranosus over here. Okay? Membranosus is running on either side and underneath the tendinosus. Okay? Then what does that leave this hamstring muscle to be? The biceps femoris. Good. So biceps femoris, semitendinosus, semimembranosus underneath. Good. What's this one again? Adductor magnus. This one is gracilis. Good. This one is the adductor longus. This one is the pectineus. Good. This one here is the sartorius. This little guy, tensor fascia latae. Good. All right, that's our upper leg. Everything except our glute. So glute muscles are normally the easiest. We're going to go back to the back side of the leg. You guys already know the glute is the butt. So we've got gluteus maximus and gluteus medius. Okay, so the medius is just deep to the maximus. If I were to take my maximus off, I could see a little bit more of my medius. There's a lot of muscles in here. There's a lot of muscles in here that I actually don't even have on your list, like the piriformis muscle is this one here. Okay, but we didn't put that on the list. So gluteus medius, gluteus maximus. Good. All right, so that is our upper leg. Upper leg. We have enough time that what we'll probably do, I'm going to give you a little more time to work, and then I'm going to at least review some of the lower leg with you and go back over this all one more time. But I'll give you a couple minutes to work before we do that.